Hello, welcome to episode 4. So far we've been busting some popular myths, including whether or not the 5-second rule is real, and if you really need to wear sunscreen on a cloudy day. If you haven't already watched the other videos, you can find them on the Right Dose social media.
So, today we have 2 more myths to debunk. Would you do the honours, Basha?
Achoo! This is definitely one I hear a lot from my patients. Does your heart really skip a beat when you sneeze?
Well, funny you say that. I hear that one all the time in the pharmacy too. As well as, can you sneeze with your eyes open? Perhaps a myth for another day.
Sneezing is of course the body's way of expelling foreign materials. The process begins when the immune system releases chemicals such as histamine or leukotrienes due to the presence of allergens or to fight infection. These chemicals actually bind to receptors on the trigeminal nerve, which causes the reaction of sneezing.
Yeah, correct. These sneezes can travel at speeds of up to 100 miles an hour. That's why you always need to cover your mouth when you sneeze. Think of all the germs. In fact, the average sneeze can spread around 100,000 contagious germs.
But the question is, does your heart really skip a beat? Some of these myths contain a tiny grain of truth, and this is kind of the case here. Just before you sneeze, we often take a deep breath involuntarily. This makes the intrathoracic pressure in your body momentarily increase, which in turn reduces the blood flow in the heart, resulting in lower blood pressure and a raised heart rate.
Then, as you breathe out, the opposite occurs. So your blood pressure increases and your heart rate reduces. On top of this, the sneeze stimulates the vagus nerve, which extends from the brain to the abdomen and causes the heart rate to reduce. It is minimal, but it does slow the heart, perhaps only to a single beat.
So, technically, it's half true. A bit of a bonus fact though, is that sneezes aren't the only thing that affects the vagus nerve. Coughing, gagging can also have the same effect. However, in most cases, the heartbeat goes back to normal and is nothing to be concerned about.
Thank God for that. I'm sure that's made all the hay fever sufferers feel much better. Okay, on to the next myth of this episode. And this one is for anyone that's woken up a little worse for wear on a Sunday morning after a boozy Saturday night. David has written in asking if a hair of the dog actually cures a hangover.
Absolutely not. It's definitely a myth. The hair of the dog, that bit is referring to the belief that drinking more alcohol will reduce the hangover symptoms the next morning. I mean, the expression itself comes from the old age idea that if you were bitten by a dog with rabies, you should put one of the dog's hairs in the wound to help cure it.
And it goes without saying that we do not recommend doing that at all. And just like the dog hair in the wound, another alcoholic drink will cure absolutely nothing. All it is doing is delaying the inevitable.
My advice is, if you're going to drink, always do so in moderation and do not exceed the NHS guidelines for alcohol units per day. One of the biggest causes of a hangover is dehydration, so I cannot tell you enough to hydrate before, during and after a night out.
Yep, and if your stomach is feeling a little fragile in the morning, you can replace lost fluids by drinking bland liquids that are gentle on your digestive system, such as water, soda water, or isotonic drinks. It's also very important to give your body a break from alcohol for a few days after being on a big night out to make sure your body, especially your kidneys and liver, recover.
So, definitely another myth. The hair of the dog is just delaying and probably worsening the hangover. And our best advice is to drink responsibly and hydrate, hydrate, hydrate.
Exactly. Well, there you have it for today. Your heart might skip a little beat if you sneeze, and the hair of the dog is definitely not the way to go. That's another myth busted.
Thanks so much for joining us. If you have any health questions or want us to explore any health myths, please leave a comment on our social media or get in touch at ask@rightdose.co.uk. Bye.
See ya.
Don't forget to like and subscribe.